This is a video for anyone that has scarring that may be feeling a bit tight. It's about, at least 8 weeks after surgery, or when the scars are healed and sealed. For example, like with the Dieppe scars, when people have a reconstruction to make new breasts, there's a big long scar from hip to hip in the belly, or even breast scars, well, scars anywhere really, but I just wanted to show you a couple of techniques just on my arm, just to show how to massage your own scars, okay? So I'll just make a little bit of a red patch there on my arm. So say that is the scar. So you're going to start off by doing some sort of deep circles on top of the scar. When you're doing scar work, you're not just rubbing the surface, you're not just rubbing the cream in, you're actually trying to move the scar around from the tissue underneath. Okay, so following the line of the scar, so now the scar is there, but you're actually going past the edge of the scar too, because the nature of scarring, you're not, depending on what the scarring actually is, you're not going to have just the top skin surface of scarring. Sometimes you're going to have layers and layers, like with cesareans, there could be 7 layers of scarring. Similar with the Dieppe and the tummy tuck, there's many layers of fat, muscle, fascia, skin, and they can create, scars underneath. They can cause little lumps and bumps. So yeah, you're doing your circles on top, past the line of the circle. So now you're going to go up on the wall of it. So push into it like you're trying to make a little C bend in the scar, like you're trying to make it bend. Okay, push into the wall of it. Get onto the other side of it. Push into the wall of it. You're trying to sort of, again, unglue it from being adhered down. And you're going to roll over it. I've got a little bit of cream on my skin here, so it's making it quite easy. But normally I would do scar work without any cream or oil, just to get a bit more of the drag. You can use cream if you want, but I just find you actually are able to stick to the scar a bit better without it. So you're rolling over the top, rolling over the other way. Of course, if you've got a Dieppe scar, you're going to be able to use both hands for this, which makes it a bit easier. So then you're going to come next to the scar and try and pinch it, not too close, because then you're just going to pinch up skin. You're going to pinch up the tissue, the connective tissue, and try and lift it off. Sometimes when they're really stuck down, especially in the middle of the Dieppe scars, they can get really stuck, and then you're not going to be able to get either side of it to pick it up. But if you can, just give it a little jiggle, pick it up. All right, give it a little twist. And then depending on where the scar is, you're going to just sort of every now and again just clear away towards the lymph nodes. My closest lymph nodes, always towards the heart, is in the axilla here, so I'm just going to clear away in case you have moved any stuck edema or lymph that may be blocked. In the breast, it'll come up to this. In the Dieppe scar, it'll go down to the inguinals. So just every now and again having a little clear away. All right, and that's your techniques really. So you've got your circles on top, make sure you're going past the edge of the scar, trying to move the scar. You can do little zigzags over the top of it. Trying to move it in all directions, diagonals, horizontals, verticals. Then you do your roll over, both ways, and pushing into the wall of it. Then you pick up, trying to grab it, and then you clear away. All right, try and do that at least a couple of times a day if you can. Scars take about a year to 18 months to lay down all the foundations, all the collagen, all the building blocks before they then become a mature scar. So you've got this opportunity now before that year, 18-month mark, before it's finished laying down all it is, and then it's a bit harder to create change. So within this time, make sure the scar is sealed. When it is close to the surgery, just do a couple of minutes, that's fine. But as it starts healing and, the further you get away from surgery, just do a little bit longer, but never more than sort of 10 minutes. But you can just do it while you're watching TV. You know, just play around with it. Just get your hands on it, and that will stop any tenderness, stop any sort of lymphatics from gathering around there, and just help that scar heal the best it can. Okay, thank you. Bye.